Let me turn to healthcare. When we talked in the White House and throughout the early stages of healthcare reform discussion, you talked about the absolute need to bend the cost curve of healthcare, that we had to bring costs into line or we're going to break the country. If there's no government insurance program, if we're not even going to expand Medicare to keep insurance companies competitive, how does the cost curve bend?
A couple of things. Number one, and something that hasn't been discussed, partly because there's been some broad-based agreement on this, we're setting up an exchange in which you've got 30 million people and small businesses who are now able to pool their buying power and negotiate essentially with insurance companies by choosing the best price from a range of different plans, forcing insurance companies to compete the same way they compete for the business of federal employees. That drives costs down. Every single what's called game changer, every idea that's out there about changing delivery systems, how hospitals are billed, how doctors are reimbursed, how we can incentivize them to plan better, reduce numbers of tests in order to improve quality of testing and diagnoses. All those things are embodied in the bill. There was a terrific article in the New Yorker just about a week ago by a doctor, Atul Gawande, who pointed out that there is not an idea out there for cost control that is not in this healthcare bill. The problem is that a lot of these things proceed by trial and error, because what we're trying to do is change behavior of hospitals and doctors and health systems all across the country. And the goal here is to create a system in which people try things out. Suddenly somebody says, you know what, we're saving money. The hospital here is saving money and reducing errors because we've got a protocol or a checklist of procedures in terms of how doctors and nurses work together to deal with a patient in a more effective way. Another hospital down the road starts learning from that, and you start seeing these changes cascade through the system. So, all I can do is talk to the smartest people in this country, the health economists, people who are involved in healthcare each and every day, find out from them what ideas they have, and make sure that's incorporated into the bill.
And then there's the problem getting the darn thing passed,
Yes.
Which is proving to be devilishly difficult.
Yes.
You thought you had a compromise last week that was going to expand Medicare to younger people, and Senator Lieberman says, well, I'm not sure I want that, and then all of a sudden we hear it's out of the bill. Do you feel as if individual senators are holding you hostage?
I think that what we have right now in the Senate is a situation where the opposition party has made a political decision that we are going to say no to everything. We're going to not be at the table. We're going to just not get involved.
Which leaves you needing all 58 Democrats and 2 independents.
What that means is
every one of them.
Every single one of them.
Every single one.
Every single one of them. And look,
anyone can say to you, if I back off, you have to do what I need you to do.
I spend a lot of time talking to individual senators.
Yes, you do.
And it's not just on healthcare. I mean, there are healthcare is the most prominent example, but one of the.
But do you feel like they're holding you hostage on this?
Here's what I'll say. Each of them have very strong opinions.
Don't they ever?
And
you think?
Many of them, I think, sometimes feel that they've got a better idea than we do. We try to incorporate as many as possible. The problem is each one of them may have ideas that are completely contrary to what the other senator wants, and so there is a balancing act. But one of the challenges that we as a country are going to have is that for our system of government to work, for our deliberative democracy to work, for the Senate especially to work, because of all the arcane procedures that are involved, you have to have a sense that occasionally we're willing to rise above party. You've got to have a sense on the part of each individual senator that every once in a while.
Do you think there's 60 senators doing that?
Well, I think it's hard. And there's got to be a sense sometimes that we're willing to rise above our particular interests, our particular ideas in order to get things done. Right now, that culture has, I think, broken down over the last several years. And one of my jobs over the next 3 years is to try to see if we can revive that. But that's tougher than I would have liked.
But when you need every vote like this, and when senators can do this to you, and those are my words, not yours, a lot of people worry that what you're going to wind up with is hash. There's even some Democrats saying now we've got a bill that's so compromised that it's not worth signing.
Let me address that specific point. Look, when I went before the joint session of Congress and talked about what I wanted to see on health care, I asked for some very specific things. I wanted to make sure that it was deficit neutral. Now, according to the Congressional Budget Office analysis, not only is this deficit neutral, but it actually reduces the deficit, something that somehow has gotten lost in the debate. Number two, I said it needs to help reduce premiums and lower costs for families and businesses. And as I indicated before, every health economist that's out there says it does so. Number three, I said that we have to make sure that insurance company abuses are reformed. You know, not being able to get health insurance because you've got a pre-existing condition, having a bunch of fine print so that when you get sick suddenly you don't have coverage. We've got the most vigorous health insurance reforms in there. And number four, I want to make sure that you had the people who did not have health care in this country and small businesses who couldn't get it for themselves or provide it to their employees, that they were able to get health care. 30 million people, according to the Congressional Budget Office, will get health care if this passes. Now, if you can tell me that those things are not worth it, then you and I have a very different opinion about what the task is here. This will be the single most important piece of domestic legislation that's passed since Social Security. And I have confidence that we're going to pass it. There's a reason why 7 presidents and 7 Congresses failed to get this done. It is really hard, but it is going to get done. And as a consequence, people who have health insurance are going to have more security with the health insurance that they've got, and people who don't have health insurance are going to be able to get it. And last point I'll make on this, if we don't pass it, here's the guarantee that the people who are watching tonight, your premiums will go up, your employers are going to load up more costs on you, potentially they're going to drop your coverage because they just can't afford an increase of 25, 30% in terms of the cost of providing health care to employees each and every year. And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable, and this actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid. So anybody who says that they are concerned about the deficit, concerned about debt, concerned about loading up taxes on future generations, you have to be supportive of this health care bill, because if we don't do this, nobody argues with the fact that health care costs are going to consume the entire federal budget.